Hi, my name is Asia Porter, and I served as the team's lead to the COVID-19 special projects this summer. My primary role as a team's lead was to oversee the progress of the juvenile justice team, the adult correctional facilities team, and we also had two interns dedicated towards looking at previous reports that the ACLU Missouri had put out, which were the Death in Custody Reporting Act report and the maternal health or pregnancy during incarceration report. And so basically my role was to kind of act as a liaison between Miss Sutton and then these special projects teams. And our goal at the end of the summer was basically just to have a comprehensive and cumulative public health and corrections report that encompassed research from the COVID-19 teams, which were the adult and juvenile teams, as well as including the previous reports in full that some WashU fellows had done back in 2018, the DCRA and maternal health reports. And so working in a remote setting was challenging, but also very informative. It reinforced this idea or the necessity for constant communication. And so at the beginning of the summer, we had set up recurring weekly meetings. So for example, I would meet with Miss Sutton and the DCRA and maternal health teams on Monday. On Tuesday, I would meet with the juvenile justice team. And on Thursday, I would meet with the adult correctional facility team. And these check-ins just allowed me to gauge progress, answer any questions they may have for me, give them next steps, as well as it allowed me to act as that middleman between the special projects teams and Miss Sutton. So if there was something that Miss Sutton had told me on Monday, later in the week as I met with the future teams, I could kind of deliver that message and make sure they were implementing the things that she had requested earlier in the week. And so this was personally for me a great experience, and it was very informative, not only in how to work in this remote setting, but just in general. I learned a lot from researching about the Department of Corrections and these different juvenile and adult facilities. And then especially with the times that we're in now, in the middle of the pandemic, I was able to learn more about the lack of accessibility of healthcare within jail and prison systems in Missouri. And so I think that it was both beneficial for my personal knowledge as well as my professional skill development.
My special project team consisted of myself and another intern. We were tasked initially with researching COVID-related injustices within adult incarceration facilities. After curating numerous resources, we began forming initiatives that would serve to address individual-related issue areas within the justice system. The initiatives we wrote were compiled into a larger and more comprehensive document that was a collaborative effort with other special project teams.
During my research, I became more aware of just how bad overcrowding is within the prison system, as well as the lack of proper hygienic products that are being provided, such as hand sanitizer and antibacterial soaps, basic items needed to ward off any sort of illness, which they're even more pertinent during a pandemic. And also just how poor healthcare is within prison systems in general. And so the research just continued to open my eyes to these disparities and issues.
I contributed research regarding a specific piece of legislation, the DCRA, or the Death in Custody Reporting Act, that will be used in a comprehensive report about deaths in custody that the ACLU will publish later this year.
And I really enjoyed doing this project. I think I learned a lot about just the health system within prisons, and I think we see through our complaints a lot that healthcare is really failing prisoners, and there's a lot of people who don't have access to adequate healthcare, and oftentimes just the healthcare system within prisons is just insufficient, and it's really not working for a lot of our prisoners. So I think it was really cool to work on a project that's trying to raise awareness about that sort of thing, and just lack of access to health within prisons. It was also interesting because, you read the news and you see like coronavirus outbreaks within prisons, and just to work on a project that was really trying to tackle some of those issues and look into how we can actually make changes within the prison healthcare system to try to mitigate some of those issues and prevent general sickness, and also just like proper care for pregnant incarcerated folks and just anyone with mental health issues within prisons, and trying to really just tackle those issues. It was really awesome to work on that report and just also learn about Missouri, because a lot of the reports were specific to Missouri prisons, and I enjoyed researching and learning about that.
First, we started off by researching the different initiatives that are going on in order to advocate for youth that are currently being held in detention centers during the COVID-19 pandemic. Then Ian put the sources into different groups to organize them by topic. And after that, we each worked on our own initiatives. I worked on medical isolation and confinement practices and the impact that those have on psychological stress and mental health of youth that are incarcerated during this time. And I also worked on another initiative about advocating for the early release of incarcerated youth who don't pose much threat to society. And this could free up more space inside crowded detention centers to better implement social distancing practices.
I worked on an initiative about changing probation practices. So that was focused on like ensuring due process is upheld, preventing new placements being put into custody, adjusting probation procedures to limit exposures between officers and community programs. And the other initiative I worked on was about the financial impacts of COVID-19. And that was emphasizing the financial strain that families are already under during the pandemic, and how that strain can just be coupled with the financial strain of having a child incarcerated. So I advocated for reducing the monetary strain on families, eliminating bail, ensuring access to medical care for both incarcerated youth and released youth, and eliminating the fines and the fees associated with the incarceration system. After that, we both went through testimonials sent from both adult facilities and juvenile facilities and picked out things that stuck out and pertain to our project about how individuals are being treated in these facilities, whether conditions are sanitary, whether the officers are obeying the social guidelines that we need to limit the spread of the virus.
And after we did all of these initiatives and going through testimonies, we sent the information to Asia, who's editing the project, and she combined what we did with what the adult team did to make one cohesive document outlining the procedures we think should be put in place to better care for incarcerated people during the COVID-19 pandemic. Throughout working on this project, I definitely learned a lot about the juvenile justice system in Missouri through our research and collaboration on this issue. I definitely wasn't aware of a lot of the circumstances that these incarcerated youth are put in, and I definitely wasn't aware the extent to which certain practices in these centers, such as solitary confinement, could have on youth, incarcerated youth. So overall, I think this project just gave me a new perspective and kind of made me more aware of ongoing issues that are prevalent even beyond COVID-19 times.
Yeah, I'd agree with pretty much everything Laurel said. I whenever I'd worked with like the ideas of like prison and stuff, I kind of never considered like the juvenile aspect of it and how it's equally important, and overall just how important it is to uphold the rights of incarcerated people and make sure that no one's rights are being limited or no one's enduring things they shouldn't have to, especially during the time of the pandemic. It was also eye-opening just to see the extent to which the juvenile justice system affects different minority groups and how there's already inherent injustices in it. And it was kind of nice. It was eye-opening to like get to work on it and help in a way to like improve upon the current system.